Much, Caroline. Can I invite panelists to come here on stage for our coach session on deinstitutionalization? Please take a seat. And I'm sure that we have microphones as well. So, good morning, Zero Project. Ready for action? Yeah. Good, 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 good. Maybe a coach for me as well? Is that possible? Dear colleagues, we're going to discuss deinstitutionalization. Where are we with deinstitutionalization? Are we making progress? We all know that still too many persons with a disability live in large segregating settings, cut away, cut out of society, and this is not acceptable. This is no longer acceptable. Still, many places within the European Union, at the level of the UN, many very positive initiatives are taken. If you have a bit of time, you should check out the paper written by Special Rapporteur Professor Gerard Quinn on deinstitutionalization. It's out since just a few days. An excellent paper on deinstitutionalization and on how we together could make progress. You maybe should check out the European Social Fund activities of the European Commission. And in so many other countries, we see islands of excellence. But we don't want any longer islands of excellence. We want a practice across the globe which is built on allowing people to live the life like everybody else, the life they want to live. And I will discuss that together with these four panelists. Ludmila, Dorothy, Tamar, and Inbal. Welcome. Welcome here on stage. Yes, a little applause. Why not? Yes, of course, of course, of course. Let me start with you, Ludmila. Introduce yourself and why are you here? Why is this topic, deinstitutionalization, important for you? Please.
Thank you very much, Luk. First of all, I would like to say that my name is Ludmila MALCOCI, and I am a white woman with blonde hair, and I'm wearing a black suit. Practically, I am leading the organization Keystone Moldova, and I'm also the regional director for Keystone Human Services International. I would like to say that deinstitutionalization is definitively a huge, let's say, issue for my organizations, because we are involved directly in deinstitutionalizing persons with intellectual disabilities and mental health in the Republic of Moldova since 2008. And we have successes, we also have lessons learned and challenges. I would like to share my expertise and experiences in this session. Thank you.
Thank you very much, Ludmila. And next to you we have Dorothy. Dorothy, please introduce yourself and why is this topic important for you?
Yes, this is Dorothy NAKATO, MUBEZI. I'm an indigenous woman with psychosocial disabilities and a survivor of psychiatric institutions. I'm a co-founder and executive director for Uganda National Self-Advocacy Initiative. It's a peer-led organization of persons with psychosocial disabilities. We aim at self-advocacy, and we want to ensure that persons with psychosocial disabilities are living independently and included in their communities and are making choice over their lives on how, where, and with whom to live. Thank you so much.
Thank you, Dorothy. Thank you. Thank you. And we come back to you, and of course, we hope that you can share experiences and models of good practice with us. Tamar, you're from Israel, but why are you here? Is this important for you as a professional or as a person?
It is important to me as a person and as a social worker My name is Tamar GEVA. I have a short haircut, a white shirt and black jacket, and I'm very excited to be here in this panel. I work at JDC Israel Unlimited, managing a housing program that help people with complex disability to move from institutions and their parents' home to independent living in the community. It's what I do every day, and I just want everyone to live in the community and to have the same opportunities that I have. And that's why
Thank you very much. Thank you very much. And our last panelist is Inbal. Inbal, please.
Hi, good morning all. I'm Inbal LORIA, social worker from Israel. I'm wearing a black shirt and also black pants, long straight hair. Okay, why I'm here? I'm the director unit of integration community in the Ministry of Welfare and Social Affairs in the State of Israel.
Okay.
I'm here because I co-manage with Tamar the expanded supported housing program on behalf of the State of Israel.
Okay.
Proud to be here.
Good, good. Thank you, thank you. And we hope to learn more about that project, of course. Dear colleagues in the room, I'm Luk ZELDERLOO. I'm from Belgium, and I wear a blue suit today. Regardless of what Caroline said earlier on, I wear wonderful shoes. Dorothy, deinstitutionalization, institutional care. Let's start with the basics. What does that mean, and what is it that we don't want anymore? Please.
Yes, thank you so much. Look, when we talk about the institutionalization, of course we have to look at what we mean by institutionalization. Institutionalization of persons with disabilities, it's a discriminatory act against persons with disabilities, and it's not acceptable. According to the Convention on the Rights of Persons with Disabilities, it deprives us of our legal capacity to choose, to have control over our lives, and an arbitrary detention that deprives us of our liberty, as explained in Article 14 of the UNCRPD. And it exposes us to many things, like forced medicalization and many other human rights violations. And what is that? To us, we look at institutions as hell, as torturing. With the experience that we have gone through, it's not desirable at all. And we want deinstitutionalization to take place. And what is this? It contains all the processes that are aimed to restore autonomy, choice, control to persons with disabilities, to have control over their lives, on how and where and with whom to live. And it has so many other components. It talks about the will and preference. Can we restore will, respect the will of the person with disabilities to choose where to live? It talks about legal capacity. Mm-hmm. Do we have the legal capacity? Can you restore legal capacity to us to make our own choices? It talks about the support that we need. Are there support services, individual support services? Do we have access to mainstream services, support services in the communities? We want states to provide mainstream services, support services to us that will enable us to live within the communities. And it talks about the enabling laws and policies. Can states repeal all laws that deprive persons with disabilities their right to live within their communities?
Yes. Yeah.
And it talks about access to housing. Are there housing? Are they safe, accessible, and affordable to us to be able to live within their communities? For us to be able to come to this deinstitutionalization, we call upon all donors, funders, governments to allocate resources to CRPD compliance from institutional living to community living.
Thank you very much,
Thank you
Dorothy.
so
Thank
much.
you. Very, very clear. Words such as choice, control, living with whom you want to live, appropriate support in the community. Would you like to add to that?
Yes, Luke. In my opinion, of course I agree with Dorothy. In my opinion, living in the community begins and ends with only one word: choice. Mm-hmm. I believe that a person with disability should and can choose everything to himself: the city, the apartment, the street, the person who will live with, and it's perfectly fine to choose to live by himself. Mm-hmm. And this is the key. This is what I do in Israel.
Yep, great. I hope that we have time for you to explain the project a bit more, but I would like to turn to Ludmila now. Ludmila, over the last 10, 15, 20 years, we are discussing deinstitutionalization in different ways and in different forms. What are the key characteristics of successful deinstitutionalization, of successful transition towards community living? Please.
Thank you very much, Luke. First of all, I'd like to say that Keystone Moldova definitely has a huge expertise in deinstitutionalization. For the last 15 years, we moved to communities more than 700 persons with intellectual disabilities and mental health, and not just moved, but supported them, to have a valuable life in the communities. And based on our expertise, I would like to say that for deinstitutionalization to have a success, there is a need for several very important things. And first of all, there is a need to have a commitment of the national government. Frankly speaking, in Moldova, we didn't have this commitment, and we started by strengthening the capacities of families to take back the kids from residential institutions, and we built on this success. Secondly, it is very important to have a deinstitutionalization strategy. Practically in Moldova, we have had this DI strategy just in 2018 with a very concrete indicators by 2026 to have 50% of persons with mental health and intellectual disabilities moved to communities. Secondly, there is a need for capacity building of all actors because nobody is capacitated in inclusion, within very segregated, let's say, environment in the past, and that's why you need to strengthen the capacities of persons with disabilities and their families to be active member of advocacy and to advocate for their rights. You need to strengthen the capacities of the staff of local public authorities because many of them do not understand what does that means, deinstitutionalization, and many of them are discriminated a lot, persons with intellectual disabilities and mental health in communities. You need also to develop services, and that means money, that means financial mechanism and changing of this financial mechanism, that money will be streamlined in community living. That means also, as I told, services based on need and based on person-centered planning approach. And here I would like to make and emphasize that person-centered planning approach is one of the key success factors in deinstitutionalizations, because you are building actions and activities around, let's say, the dreams of persons with disabilities, and you are supporting them. Community strengthening also, you know, in our case, for example, we developed community support groups that were part of this person-centered planning process and that supported persons with disabilities to
So
implement.
that includes moving away from a medical approach?
That means moving away from
Moving
medical
away
approach,
from the needs, but the wishes and the dreams of the people?
And the dreams of the people, and supporting these people to have his own life in the communities, because all of us have dreams and we need some support sometimes, you know, to live a decent and valuable life in the communities. And not last, I will make a point on partnership with national and public authorities, because you alone, you cannot do anything. You need to have a comprehensive approach. To have a sustainable reform, you need also to work on development of inclusive policies in line with CRPD. Thank you.
That's quite an agenda, Ludmila. Yes, please. Political support, having a plan, a strategy, indicators so that you can measure whether you make progress, yes or no, capacity building, person-centered support services and systems, yes, indeed, and partnership, cooperation. Do the others want to add to that? Is there something missing in this? Yeah, I see, Dorothy, that you want to come in. You want to add? Is there something missing in the key success factors?
Yeah, the key success factors is also involving the persons with disabilities themselves through their representative organizations. Because like, as we do the deinstitutionalization, can persons with disabilities themselves lead the processes? As for us, we in Uganda National Self-Advocacy Initiative is running a program that is called Support My Choice. It's empowering survivors to be champions of change, to lead the process of deinstitutionalization. Thank you so much.
Okay, thank you. Thank you, Dorothy. We are sitting here with representatives from Africa, from Eastern European, Israel, but in the room we have people from Western European countries, from the States, from Canada, from Latin America. Tamar, does the institutionalization, the processes, the mechanism we have to kickstart, so to say, are they different from continent to continent? Is there the economic situation of a country? Is that important? Is that relevant? Your views on that, please.
I think that it's very relevant, and we see that it is relevant because the difference between country to other countries is we can feel it. And I think that the institution, DI,
yes.
DI.
It's a very difficult word, so we decided to say DI. That's okay for everybody, I hope? Yeah, okay, please.
Okay. I believe that the DI is just the beginning of the journey. In the end of the day, the goal is not just seeing empty institutions, but the main goal is to see independent people living a full life in the community. Mm-hmm. And in order to succeed in this mission, okay, there are many components that need to work together. Mm-hmm. Like, if there is a law that defines the budget, the support, the services, is the people with disabilities and the family members holds the knowledge and the attitude towards independent living, decision-making, and they are empowered enough to do the move. And if the infrastructures in the community are ready, is there an accessible apartment? Mm-hmm. Is there enough services? Mm-hmm. Is there enough opportunities in work and leisure for people with disabilities, no matter how complex the disability, can participate. And the attitude of the public. And I can say that I see even in Israel, according to your question, that even if we are supporting a person that decides to live in a city in the middle of Israel, or we support a person that decided to live at the periphery, or an Arab village, or in the religious community, the approaches are different. We need to listen and be very close to the person and create again and again the solution, the support, the coordination between all the services, and that's why I think the answer is definitely yes.
Yeah. Would the others like to come in? Are there cultural differences? Should we develop different approaches?
Yeah.
Please.
I would add a little bit here,
Yes.
because I started during the previous question to answer that. Practically, it depends on the how government is ready to do this, the institutionalization process, and it depends also of resources. And here in Moldova, you never will have that all those factors will be in one time, ready, and you can just start the deinstitutionalization process. Sometimes the eye lasts for 10 years, for 20 years, and so on, because in time you also need to change, let's say, the mentality of the people, of the governments, and you have sometimes changes of many governments, and you need to start from the beginning, and so on. But you need to start, and in this case, you need to think on the factors that are now in your country today. And for example, in my country, we couldn't enter the institutions, but we started with strengthening the capacities of parents, of local public authorities. We found, let's say, leaders that agreed with our ideas, and we started this DI from the back, from the, let's say, from the communities. The first year we have had like 22 children back in communities because parents decided, to take back their children. We just supported the parents with some households, with some, personal places, designing and supporting, and that's all. And I think that each country has particularities, and we need to analyze very carefully all these particularities and starting just the process, not to be too late,
Yeah. Well, the best way for deinstitutionalization is never institutionalizing children, so family support is absolutely essential. And a good friend of me once said, there is no way to inclusion. Inclusion is the way. And that is, I think, a very important message. But Dorothy, you wanted to come in. I could see that you want to contribute to this as well. Please.
Okay, thank you so much. Of course, the economic state may be challenging, but what are we saying? We want the states to prioritize community living. Can resources be allocated not to institutions, but to community living work? There is a lot of resources, like in Uganda. The budget that goes to mental health is just 1%. And that 1%, 99% of it goes to institution. Repairing, renovating, putting more beds. We would like to reallocate resources to CRPD compliance, to community support services that will support us to live within the community. And she talked about the mindset. It's all about the mindset of the policymakers, the families and the communities that we are working towards to change. So we are calling upon all mindsets from institutional living to community living. Then the institutionalization will take place. Thank you.
Yeah. It is indeed also about stopping the funding going into the wrong direction, of course, and that is quite often very, very difficult because it requires a shift in thinking, a shift in approach, and it was brought up by you, Tamar. Deinstitutionalization is not only about bringing people into the community; it's also make sure that they have high-quality education, that there is possibility to go to work, cultural participation, a real family life, all these elements are equally important. And you talked about a family project. Can you explain a bit more what that means, that project?
It's not a just family project.
Okay.
It's actually it's a plan for every person with disabilities. We are working very hard to adjust the living in the community for person with disability. We work we don't want to close the institutions. In Israel, we prefer making the community, the life in the community, prepare for person with disability with all the factors that you talked about, and even more. So we don't close the institutions. We just take people from there, and we don't take. They want to move from the institutions to live in the community. And we help them. We build a program that adjusts them to live in a city, to live in a city that they will choose.
And what are the key building blocks of that program?
The key building will start with, of course, the workplace, the opportunity to take leisure, and to make friends, and to choose what they want. It starts with this, and we just help them. Mm-hmm. It's a lot, but we're just helping. They want what they decide what they want, and we are here for them.
And do you use special techniques to empower people so that they can decide about their own life, about their own environment, where to live and with whom to live?
Okay. Usually, the people in our program, they can express themselves. Mm-hmm. So I don't use any special technique, but I think in the further future, it will be even for a person that cannot express themselves by speaking and normal communication, mm-hmm. and then we will need special needs for them.
Techniques like supported decision making and so on.
We use
Ludmila,
this, yes,
you
of
work
course.
with persons with intellectual disabilities. Do you have special techniques or methods to empower people?
Yes, we have. We have, first of all, the philosophy, and that is social role valorization, that person needs to live a valuable life in communities, That means that he has a family, he has friends, he has colleagues, he goes to work or to school, and he has a very nice life like all of us have in the communities. But the tools that we are using for is person-centered planning, and practically this tool is used also to assess the needs of persons with intellectual disabilities, and is used also to focus on all the actions around persons with disabilities jointly with persons with disabilities, because they are part of these groups of support practically. And also these tools encourage us to have these community support groups, part of this person-centered planning process. They are coming together, they are discussing together the needs with persons with disabilities. Based on that they have a plan, they plan, and after that, once in several months, they have a revision of this plan, progress of this plan, and persons from communities are involved in. I would like to say that this tool is also very good to change the attitudes of communities regarding persons with intellectual disabilities and mental health, mm-hmm. because the main leaders of the communities are in these support groups,
Yep.
and they understood from the ground, not based on brochures or booklets, what does it mean, needs of persons with disabilities, and from the very beginning, they are involved in the process of supporting these persons and the family, and in this way, we are combating also discrimination. Thank you.
Okay, thank you. Dorothy, it's all about giving the steering wheel of the support system back to the people so that they can control their own life and their own support system. How do you think people should be empowered or prepared to do this work?
Yes. Thank you so much. We have discussed that it's not about just taking people back to their communities. That is not deinstitutionalization. I'll give an example. Like in Uganda, the big institution, Butabika Referral Hospital for persons with mental disabilities. It's overwhelmed with the numbers. And what do? They just put people in a bus, take them to the community and say, can you reach home? Is this where you're home? And dump there. I would say dump. Because there is no follow-up. There is nothing. But what do? As Uganda National Self-Advocacy Initiative, our program that we call Support My Choice, we prepare the person, when the person is still in the institution, prepare them for reintegration, and then prepare the families, the community where this person is going, and then make placements. Then continue following up with the person through peer-to-peer support. And follow up until the person is resilient enough to live within the community. And this has been very successful. For the people that we have supported to leave the institution, they have sustainably stayed in the community, very happy, and they are empowered to continue the advocacy, to support other peers, survivors of institution, to live within the community. So we do a lot of training to the community and also to the survivors of institution and those at risk of being institutionalized and the families, the policymakers. We are making a lot of move to the policymakers to make sure that they understand this, they change their mindset, that actually people with psychosocial disabilities can stay within their communities and live. Mm-hmm. Thank you so much.
Yeah. Like Ludmila said earlier on, the political will, the political commitment is absolutely essential. Thank you very much for making that point again. I would like to go back to you, Tamar. While Dorothy was talking about this support system, you were nodding. Can you explain a bit why you were nodding? You agree, I saw, but can you explain how you do that?
I believe that Ludmila said, all the basics and all the main things we do in the program. And I just, if it's fine by you, I just want to add the perspective of the parents. Mm-hmm. My friends here mentioned the families and the parents, and I think that, of course, parents and family members are affected by any decision of their son and daughter. And in an environment that institution is the reality for parents, and I met many parents, they hold the thought that this is the next step. There is going to come a time when they will be able to hang the jacket and move their son to someone else that will take care of them, mm-hmm. Okay? And changing this perspective, changing their attitude, supposed to be with a deep support and compassion, because they are affected and they are worried, and they hold attitude that we are responsible for, okay? And I think that every support service supposed to give a decent support to the parents and help them to support and be, I'm sorry, Shulamin? I'm sorry.
It's okay.
I think that I said enough. Yep. Thank you, Mr.
Thank you very much. We slowly have to bring this discussion to an end. And I think that we agree here that this process of deinstitutionalization, it's taking too long. We should make progress, it should go faster, and it should be more effective. We should give the control of the lives back to the people that are in these institutions, segregated from society. What would be your game-changing intervention that really can make a difference that really can bring change.
Okay, so it's only my opinion about
Yeah,
the
yeah.
game
Well,
changer.
that's why you're here, because we value your opinion.
Okay, I believe that the real game changer will start by education. I think that if we will teach tolerance and acceptance at the very young age, I mean, since even kindergarten, we will get a better society and a better community. And it will be inclusion.
Yeah.
We will get that. Yeah. And if we will invest in the education, that will be our future.
Don't segregate and invest in education.
Yes.
Yeah. Thank you very much. Ludmila, what would be your game-changing intervention, the intervention that really, in a way, kickstarts a snowball process of inclusion?
You know, I'm very practical in this case because I'm, working for many years in disabilities, and I would like to say that the main intervention shall be, first of all, moratorium on institutionalization from the government side, because if this moratorium will not be in the place, you'll still have persons with disabilities in institutions. Mm-hmm. And at the same level, another factor will be empowering families and the parents of persons with disabilities in order that they will know, that for their kids, the qualitative and valuable life is just in the community. And not the last moment, I didn't talk about this like a factor of success, is you need to have a national complaint mechanism for persons with disabilities, even those living in residential institutions.
As part of the monitoring machinery.
As part of monitoring. And I would like to say that in Moldova, we succeeded jointly with the SPD to develop a hotline service that is working 24 hours, 7 days. And practically, initially, this hotline service was for persons from residential institutions. Okay. Now it is a national-wide one, and it is financed by the government. And
Great.
That is very nice.
Thank you for sharing that with us. Tamar, what would be your game-changing intervention if you could suggest something to the authorities or to...
I think that partnership.
Partnership.
I think that if the government and the NGOs and people with disabilities and their family members work together to fulfill our dream, I think that this is the key factor to succeed.
Yeah. Cooperation.
Cooperation.
Co-creation. Partnership. Thank you very much. Dorothy, your game-changing intervention, please.
To me, it's all about accepting all humanity, that we can live together, and changing the mindset, our mindset, from institutional living to community living. And it must start now. Now. We need to act now. We need to really act. Otherwise, a lot of people are suffering in the institutions. There is a lot of suffering, and we need to act now. I agree with her. We need partnership. We need to work together as a whole to bring to inclusion. What is that true inclusion? That we should all be together. Segregation should stop. Thank you so much.
Thank you very much, Dorothy. An applause for the panelists, please. Thank you very much. And I will not try to summarize what was discussed, but I would like to end with one sentence. There is no way to inclusion. Inclusion is the way. I wish you a very interesting day and a last day tomorrow at this Zero conference. Thank you. Bye-bye. Thank you.